Now we start scanning the right lower abdomen. Here we see gases in the distal ileum as thin echogenic line. Now we continue scanning to the right iliac region to find out the cecum. Here we see the distal part of small intestine is inflamed and walls are thickened. This is cecum. The walls of cecum are also inflamed. The submucosal wall of cecum are thickened and echogenic due to inflammation. Now we continue scanning around the cecum to find out appendix. Here we see a small ring-like structure which is surrounded by echogenic tissues. On rotating the probe at its axis, it becomes a lumen. This is appendix which is inflamed and surrounding tissues are also edematous and echogenic. Here we see debrinous fluid around the appendix. Now we will measure the anterior posterior diameter of appendix. The appendix is inflamed and the anterior posterior diameter of appendix is 11.3 millimeter. This is ascending colon which contains food and gases. The walls of ascending colon are not visualized and normal. Now how we will write report.